and you're watching Medicircle. Today we have with us Mr. Ashish Kumar Jha. He is a preventive healthcare and fitness coach, a certified personal fitness trainer, an art of living trainer, and a spine care and posture yoga coach. Please welcome him to our show, Rendezvous on Universal Health Coverage Series. Hi Ashish, how are you?
I'm fine, thank you. It's really honorable to be along with Medicircle.
Thank you. Okay, Ashish, to begin with, what according to you are the challenges and opportunities for advancing universal health coverage in a world coping with COVID-19?
See, there are presently, if you can see, like healthcare is really very challenging. This COVID has really evolved healthcare. Um, because before healthcare there was no regularities.
Right.
It's just like the private players are just kind of charging so much money to from the people, uh, from general people. So basically I mean the main challenge is really good on costing. The real challenge is about costing, how they provide the universal health coverage. That is very much challenging right now,
Mm-hmm.
because if we talk of government, Indian government,
Mm-hmm.
they too had declared in their budget. I mean, basically, I think they have declared 2,000 crore rupees for each and every person in India, and there are approx 130 crores people in India. So
Right.
that according to that, that is really low. if you
Mm-hmm.
if you take each and every people, because lifestyle diseases like diabetes, cardiovascular problems, these are really prominent
Mm-hmm.
in today's world. Communicable diseases is yet low, but these lifestyle diseases must be seen at a very peculiar way. They must concentrate on this. And deployment of the skilled medical persons in the rural areas, this is also very important point to be discussed.
Right.
Because the people, basically the doctors or nurses, these kind of guys are not deployed in the rural areas. Like there are so many villages, like the doctors are not available. So people, the death rate is really high at those places. Also, you can see that these today's private players are charging so much fee from the patients that it is really whooping. So people has a mentality that, if they get any problem, they will be kind of looted if they go to
Right.
hospital.
The
So
hospitals.
this is really, the people has to think on this.
Right.
So empaneling private healthcare is not always feasible for the normal people.
Right.
So I think these three are the real challenges in the healthcare sector presently.
True. Okay, with developing technology and research, we are now able to do a lot of things which we were impossible earlier. However, there's a gap in the pursuit of equity in access to quality health services for all in terms of financial approach. What are your suggestions to overcome them?
Yeah, there are inequalities presently, but I personally think that health awareness should be there in public.
Mhm.
Government as well as public sector as well as private sector has to take some initiative to make the people aware. Like, for example, these days, few days back, people were not wearing mask. People were not following the COVID rules. Once Modi came again, and our Prime Minister came on the television and told the people about, or you can say he awared the people,
Right.
and then people again started wearing all those things, all those or taking care for COVID. So again, the numbers are going low. So at a regular interval, there should be an awareness program for the people. Today, in the rural areas, if you go, people are still not wearing masks,
True.
and nobody is actually knowing that they have got the COVID also. They
Right.
think that this is normal sardi khasi, the normal
Mhm.
cold and cough, so they ignore it,
Right.
and then a lot of people are getting infected, but nobody is there to check it out. No test is going on. No officials are there to check them that if they are in problem or something. People are dying, but nobody is knowing about it.
Right.
It's still under the cover. I know various families in Bihar who are really unknown what is actually COVID
Mhm.
and how does it affect. You think that this is normal cold,
Right.
so they can overcome it because they are from Kisan families, so they work
They have,
so
right.
they work a lot. Their immunity is at and very great. So this COVID cannot affect them. But this is not the thing which should be considered at all. You know, recently the Rock, one of the WWE player, he on a single day he does his exercises for 5 hours, but still he has got COVID.
Right.
So have doing a good having a good routine of exercises doesn't doesn't prove that COVID won't infect you.
Mm.
So these are the things which should be taken into taken as a task, and awareness should be there for the people at a very regular interval.
Mhm.
This is the only way to make the people think that they are vulnerable to various problems. Maybe it is lifestyle diseases, maybe it is a communicable disease, or any disease, any problem from their health. So that is why my startup is into preventive healthcare. So we basically help corporates as well as the people, the normal individual, to get themselves complete body checkup at a regular interval. This alarms them that they are going to face these kind of problems in a certain time. So they take care of themselves from the very moment when they are tested. Not only for COVID, there are so many as diseases like diabetes, like lifestyle diseases. You can say like diabetes. So I have seen people of 28 years, their blood sugar level is at boundary. So if the blood sugar level increases from that position, definitely they will get diabetes at an early age. So if they are tested at this moment, they have the idea how to take care of themselves. They consult me for their fitness program, or you can say like lifestyle programs. They consult me for that. So I give them a proper training, give them a proper diet so that they can control it. So this is what I do, and basically this is what I think about the healthcare awareness program.
Right. COVID crisis bringing in the cash crisis. Do you think we will be witnessing investments in promising health tech startups providing affordable care?
Yeah, of course. I mean, this cannot be a constraint. You don't have money. This cannot be constraint actually for the healthcare at least. Uh, it is a very good saying in Hindi. Health रहेगी तब तो कमाओगे ना, life रहेगी तब तो कमाओगे ना. So this is you have to think about your health at first. I mean, this should be always your first priority. Doesn't
True.
matter if you really have so much money or not.
Mhm.
If you take it in a regular interval, it will drastically reduce your investment, drastically reduce your payouts. Because once you are infected, or once you are you can say like once you are diseased, you have to invest in hospital, and there minimum to minimum 1 lakh will be invested. Like in COVID also, there are free hospitals also, there are paid hospital also. I have seen many people, if they have got a COVID infection, definitely they have to throw away some minimum 70,000 of rupees.
True.
So is it that feasible? It is not feasible, I think, for any class of people, maybe rich class of people or normal class of people, or I
Mhm.
mean lower lower category people. It is not feasible for them. So they have to look over investment. And if we talk of corporates, no doubt, they do have to grow. So health is always, their employees health is always at a very high priority.
Mhm.
And these kind of investment can enable healthcare to get the things done. I mean, you can see through technology. These days there are so many things coming on in the technology also, like AI, data science. These are
Right.
contributing in healthcare. So these must be encouraged to perform the duties. This will only, can say, this will only make the healthcare affordable,
Right.
won't be too costly.
Mhm.
So these kind of investment, I mean, this crash crisis won't. I don't think it would affect the health tech startup, or commonly healthcare startups.
Okay, in a country like India with a huge population of 135 crores and growing, which high impact policies must be considered to protect people's health and comprehensively address the mission of health for all?
Basically, I think about this that you can say like that there is so much of inequitable and inefficient methods of healthcare financing, right?
Mhm.
So if a person goes to hospital taking his whatever disease he has, the treatment is always out of pocket. So the payment they have to do, which is really whooping
Right.
for them, for their family members. So eventually they had they what they do. I mean, there are so many strategies. Somebody sells their land, somebody sells their farmlands or something to just get operated,
Mhm.
right? And today's private health sector and government health sector, these two are the sectors which should come at a same level. You can say like costing perspective. Today's private healthcare is charging so much of fee, which is not affordable. But government is charging nominal fee, but the
Mhm.
facility is not there. Facility is not good
Right.
there. So people has
They don't have
no
choice.
way where should they go.
Hmm.
They can't go to government because people, I mean, doctors are not good, facilities are not good. They have to go to private sector, and they don't have money.
Yeah, they're
So
left with no choice.
these two, they are left with no choice. So private sector and government sector should come at a equality level, so that it can make much affordable healthcare for the normal public.
Mm.
I think this should be improved.
Right.
Rest, you can say like the equipments what we use in hospitals, their quality should be improved, because before COVID there were technologies, no problem, there were devices, but that was not at the you can say best level or a better level.
Mhm.
Like you can say like ventilators, there were ventilators at that moment also before COVID, but the ventilators was so low. I mean, the quality of ventilators was so drastic, so disaster. So this should be improved. a policy should come that a hospital should be all the devices of an hospital should be audited once in a year on the basis of quality.
Right.
So this is how we can ensure health for all, I think.
Thank you so much, Ashish, for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you very much.
Thank you. Have a good day.